LawMD brings the unique set of resources both to evaluate whether the medical care was done properly and also to make sure that the right experts and information are presented to the insurance company and to the jury to ensure that they're fully and fairly compensated.
I think LawMD has a better insight into the medical problems.
So with LawMD, one of the advantages that we have is that when we get a case, we have several members that are all in different specialties. So we can take that case and send it to one of our lawyers, that's a physician, who's got special expertise in that area, and he can look at that case and then make a decision pretty quickly who really needs to look at the case to give us that bottom line, most in-depth evaluation.
LawMD has combined years of experience within the same law firm that are many, many times the years that other attorneys have.
With LawMD, the client ultimately will wind up saving tremendous amounts of money. LawMD, we have the expertise there. We have people who are MD, JDs, who basically do this every day in their clinical practice, and they'll be able to give us the answers much quicker.
And for us at LawMD, having this broad sort of depth of specialists, neurosurgery, OB, emergency medicine, you name it, we can absolutely find that needle in the haystack, which oftentimes it is. It can be a very subtle issue that someone could easily overlook. And that person, if that happens, they may not get the justice they deserve. And so for us, if I might not know, let's say, okay, I feel like there's an issue here, but it's maybe a bit out of my area of expertise, I can rely on my colleagues at LawMD to say, you know what, Peter, there is a case here, and here's why. And then we can take it from there.
Your average medical malpractice law firm, the attorney is going to probably have to find a medical expert to look at those records. At LawMD, you skip that step entirely. A medical expert is going to look at your records first, not second or third. You may feel like you're hiring this high-powered firm full of physicians. It could, in the end, save you money and be the more economically viable route to take.
The idea is which of us, either as an individual professional or as a group of professionals, are in the best position to, one, size up that client's issues and problems, and then two, provide or at least recommend a solution. For me, it's bringing all of this expertise together on behalf of a given client.
One of the unique features of LawMD is that we are a collection of doctors who are also lawyers, and we represent a wide spectrum of specialties. So if I have a case that involves a neurosurgeon or involves an obstetrician or involves some other specialty, I have colleagues in LawMD just go and knock on the door, and I can have a consultation, immediate consultation, that saves us both time and money so that we can prosecute the case quickly and effectively. So I think that the real value proposition of LawMD is the fact that we represent multiple specialties and that we're all attorneys.
All of us are physicians who are attorneys. We all have our own resources, our own specialties, and combining that in one organization, it just makes a lot of sense. I meet people all the time that tell me, and these are professional people, say, I didn't even know there were doctors who were lawyers. And I'm just flabbergasted, okay? Because, that's my life. That's our life. That's LawMD.